Welcome to the Canadian Beef Cattle Podcast, presented by the Beef Cattle Research Council. The most popular content from beefresearch.ca, available on the go. Before we get into today's episode, a quick message from the BCRC. Have you calculated your herd's calving distribution? Calving distribution is the percentage of calves born in each 21-day cycle throughout the calving season. The benefits of having a shortened calving season include being able to market larger, more uniform calves, increased cow longevity, easier coordination of herd vaccinations, and easier comparison between calves. The BCRC's Value of Calving Distribution Calculator allows producers to see what their current calving distribution is and what the short-term economic benefit would be if they moved to the industry target of a breeding season of 3 cycles. Access the calculator by clicking the link in the show notes. And if you're looking for more Canadian beef content, check out the Simply Verified Beef podcast, hosted by Verified Beef Production Plus. Tune in monthly to hear experts and fellow producers and topics ranging from nutrition to genetics to public trust. Episodes include practical insights for Canadian beef producers and focus on answering the questions that matter to your operation. Subscribe now wherever you get your podcasts, and be sure to follow along on Instagram and Facebook at Simply Verified Beef. This episode is titled One Health Strategies. For Tyler and Nancy Haragas, March 10th, 2018 will forever stand out in their minds. It was 40 below with 4 to 5 feet of snow, recalls Tyler. It had been a brutal winter with unrelenting cold and a record snowfall that persisted into March, and spring simply refused to come. In order to give their expected calves a fighting chance against the cold, the Haragas brought in heavy equipment to clear snow off a large area and packed it with clean, dry straw. As the cold continued and the calves began to come, Tyler started to notice a few sick calves. There were a couple with scours, and we never have had scours, says Tyler, who attribute it to the unusually harsh conditions. At first, the calves seemed to respond to treatment, but as more calves hit the ground, Tyler realized there was a major problem. "We've got a wreck," he said to Nancy, who was home caring for their children nearly 3 miles from the farm site. As the sick calves kept piling up, they had nearly 40 calves in IV therapy at one time. It was physically and mentally draining. "We were so tired, so depressed," says Tyler, who, along with his father, worked around the clock to save as many animals as they could. Despite the numerous offers of help from friends and neighbors, the Haragas were worried that the problem was potentially contagious and didn't want to risk passing it on to neighboring operations. "There's no point in devastating the entire country with it," explained Nancy. Despite the stress, the Haragas showed resilience and forward thinking, seeking out options through the Diagnostic Services Unit, DSU, at the University of Calgary, Faculty of Veterinary Medicine, UCVM. Lindsay Rogers, Program Outreach Coordinator of the DSU at UCVM, says, "We have 2 different ways we can help. One way is with diagnostics, and the other way is with veterinarians and animal health experts that can go out to the farm. The DSU works in cooperation with the local attending veterinarian to help in cases where further investigations are required beyond what the local practitioner is able to provide." In the Haragas case, the DSU diagnosed the fast-acting pathogen infecting their calves as Cryptosporidium, or Crypto for short. Cryptosporidium is a microscopic parasite that has a tough outer shell, making it very durable in harsh conditions. The parasite spreads through contact with infected animal feces or contaminated water sources. It only takes a tiny little speck to touch that new baby, and they're infected, notes Nancy. By the time the Haragas had a diagnosis, the environment was already saturated with Cryptosporidium. For that year's calf crop, supportive care and quickly moving the naive calves and pregnant cows as far away from that straw pack as possible was the best action to take. While it is distressing that lag time in testing causes an illness to spread, getting a correct diagnosis is pivotal. We are able to do things to help prevent infection in subsequent years in that herd, says Jennifer Davies, a veterinary pathologist at UCVM. Once the diagnosis is made, the DSU team can work with the producer and their veterinarian to help make plans for the present outbreak and future management of the herd. Cryptosporidium, like many scour-causing pathogens, is a zoonotic disease, meaning the pathogen can infect both animals and human hosts, transmitting from one to another. As a pathologist, if I diagnose a case of Cryptosporidium in a scouring calf, I'm then making a comment on my note back to the veterinarian. This is a zoonotic disease. So if you or other people such as a producer have come in contact with these calves and are experiencing any illness, it is important to seek medical care and let them know about the potential exposure, says Dr. Jennifer Davies. The potential for exposure for the Haraga family was high, and the entire family was at risk. So, when their 8-year-old son began showing symptoms, it was no surprise to the Haragas that one of them had fallen ill to the highly contagious zoonotic pathogen. Nancy recalls the day that she rushed her son into urgent care. He couldn't stand. He was just in the fetal position because there was just so much pain in his stomach. When a zoonotic disease is identified in a human, public health becomes involved to help identify the origin and prevent possible spread of that disease within the population. We will help support the producer with strategies and management techniques to try to prevent additional transmission, explains Theron White, Disease Control Coordinator with Environmental Public Health at Alberta Health Services. In the case of the Haragas, the veterinary team, the DSU, and the public health all work together in what is now known as the One Health Initiative. This model of care has all interested parties working as one in a well-connected cluster of resources, each acknowledging the importance of each other to achieve a common goal. The One Health Initiative is the understanding that human health, environmental health, and animal health are all intricately connected, and we can no longer put each of those in a silo, says Dr. Rogers. In the aftermath of this devastating outbreak, many lessons were learned. For example, the Haraga family has become very conscious of where their boots have been and what they may be bringing home. We definitely have become more aware. Our kids have become more aware, says Nancy. They may never know how the pathogen arrived at their farm, but by having a solid biosecurity plan, they can do their best to ensure other diseases cannot follow suit. As for the herd, they know that Cryptosporidium has the potential to resurface if conditions are right, so they have a biomanagement plan which includes a strategy to ensure this doesn't happen again. One strategy they have implemented since the outbreak is a spring calving program. When asked about the results of this decision, Tyler says, "Cows are calved out on grass and they get up bouncing." Tyler and Nancy will never be able to recover the genetics lost in the outbreak. The financial burden of wrecks like this is often felt for years. However, the Haragas family's cooperation with a One Health approach, including human and veterinary diagnostic teams to create a plan and prevention strategy, as well as their willingness to share their experience, has been a silver lining. Nancy offers this as her closing advice. Don't be afraid to talk about it. You should be talking about it because somebody somewhere has gone through it and they're going to know someone who can help you. Thank you for listening to this week's episode. You can find all relevant links and information at beefresearch.ca or in the show notes. The Beef Cattle Research Council is funded by the Canadian Beef Cattle Checkoff and strives for excellence in the production of Canadian beef, cattle, and forage through research, innovation, and extension. Tune in every Tuesday as the Canadian Beef Cattle Podcast delivers straightforward insights, expert information, and a wealth of practical knowledge for Canadian beef producers. Subscribe now.